All right, everybody, welcome to Experience Talks. I want to welcome Dr. Thomas Cudjoe to the show. Dr. Cudjoe, welcome to Experience Talks.
Thanks so much for having me. Happy to be here with you all.
So I want to give people an impression of who you are. Dr. Thomas Cudjoe is an assistant professor at the Johns Hopkins School of Medicine in the Department of Medicine, Division of Geriatric Medicine and Gerontology. And he's also a core faculty member at the JHU Center on Aging and Health. Dr. Cudjoe is a major in the U.S. Army Reserves and a participant in the inaugural cohort of the Robert Wood Johnson Foundation Culture of Health Leaders Program. He's focused on understanding how social factors influence the health of older adults and developing strategies to improve the health trajectory of older adults. His research is focused on identifying risk factors for social isolation and currently examines the relationship between social connections and health outcomes. So Dr. Cudjoe, I want to first talk about you as a person. So tell us a little about your personal journey. What made you want to become a geriatrician, which is obviously one of the rarest parts of medicine, as we know.
Yes, we are rare, but hopefully with time there'll be more of us. So I guess I'll start with I was born in Philadelphia, Pennsylvania, and my mother had me and my brother, but she was from a small town in Georgia, Macon, Georgia, and she decided to move back home because her parents were there and they were getting older, and she wanted to be there to support them, and also for us to be around most of our family who were in Georgia. So we moved back, and I would say I had a fun-filled childhood, but it was primarily spent in the context of supportive family relationships, and notably, I would say that the relationships, included my grandparents, my grandmother, my maternal grandmother and grandfather. Both lived nearby. I was in my younger years, and then in my adolescent years, there was periods of times that I lived with them and they lived with us. And so I got a close exposure to what it meant to be a caregiver, changing diapers, medication management, assisting with my grandparents' walk. The whole 9 yards, providing nursing care as they age. And as I got older, I actually went off to high school, but it was during one of the summers that I began going to the doctor's office with my grandfather. Particularly my grandmother had passed away by this time. And I decided to go to college. I had, other interests, decided to, I was thinking about law school during college, and it was after my first year of college, I happened to be home and went to the doctor's office with my grandfather. And my grandfather's doctor was like, "You should consider medicine." And I didn't think anything much about it. And went back to college for my sophomore year and began really thinking more about it, and went through the rest of college and with kind of considering going to medical school. And when it got to the time to apply, I applied to medical school and went through the motions and the studies of medical school. And I would say during my third year of medical school, I had a rotation in internal medicine. And one of the things that the attending physician did, who led our rounds and things, was that we walked patients during rounds. Like, we would get the patient, we would help the patient out of bed and try to assist them to walk around the ward that we had there at the hospital. And that kind of was different for me, and it kind of inspired me to think about geriatrics. He was a geriatrician. But I would say it was really I took off a year between my third and fourth year of medical school. I was right during the time of the Affordable Care Act being passed. And like I had these previous interests in trying to improve the health of people more broadly than their direct patient care. And so I took off a year and went to Harvard School of Public Health to do a master's in health policy. And during the spring of my year off, I took this class on the economics or issues of aging. This economist had gotten interested in older adults experiencing the caregiving of her own parent. And that time, I would say, inspired me to want to go into geriatrics. And so like I applied to a residency and knowing that I wanted to go into geriatrics in the care of older adults. So went through residency, and then when it was the time to apply for fellowships, I wanted to go to the best place that I could go, and came to Johns Hopkins and did clinical fellowship and also research fellowship. And during that time, I would say I juxtaposed and reflected upon all the different things that I have been done in life, and realized that really around my interests were around how do people connect and how that impacts their health.
Yeah, I want to talk about that. Yeah, no, fantastic.
Yeah.
No, I think it's always important to get to know who people are and where they come from in terms of, what to do with your life is a big decision. So I always like that. It's one of my favorite stories is how did we get to where we are? I want to talk about the research and what first spurred you into having an interest in social isolation, and then can you talk about what you're doing, what your approach is with it, and maybe why it's important too.
Yeah. So I would say a combination of things. I would say that I knew that there were things outside of direct patient relationships that were impacting people's health. So like I would say that that's part of the reason that I wanted to do my MPH, and I would say reaffirm during those times in terms of like trying to support and advocate for people's health, not just in the one-on-one interactions that a doctor and patient might have. Those interactions are critically important, but I sought to want to do work that was to advance and improve health more broadly, and sought during my clinical fellowship in geriatrics to get exposure to what I could do more broadly. And during the time that I was thinking about what would be the next step, would I go down a more policy route? Would I pursue research? I got interactions with mentors here, got interested in how social factors impact people's mobility and their health. And when I began realizing, more about, how to conduct research, I was also amid this program that the Robert Wood Johnson Foundation funded. I applied and was really interested in becoming a leader in clinical medicine research and also like community-based efforts and advocacy. And so, like I would say during maybe one of the convenings that we have for that leadership program, like I really begin to realize that our connections are so meaningful, and that in some instances, certain people don't have them. Like I'm overlaying a lot of different things here. Also during this time, I was digging in clinically and getting doing more house calls and really beginning to identify how individuals who are homebound. And so I remember this one patient who I saw in a subsidized housing setting, and the house, on the outside, it was a new developed community. They had like a library, exercise room, all these different things. But I remember walking down the corridor to her apartment and realizing that it seems so desolate, even though it seemed like it had these amenities. And the conversations with that patient, were filled with me trying to understand and support her medical issues, but also realizing how she felt like isolated and she was lonely, and so I think after that, I began to reflect upon my grandparents' my experiences with my grandparents, and also juxtaposing that to, I didn't mention my paternal grandparents. My father's from Ghana in West Africa, and as a child, I visited there multiple times, and my grandfather came here. So juxtaposing these various experiences about how people age and how some people don't necessarily age in a context where they have connection to others, and how that may impact their health, I would say had a big impact on why I'm doing this work. So combination of life experience, great mentorship that exists here at Johns Hopkins, and also interesting clinical experiences through home-based medicine, I would say brought me to understand more about social isolation. And I would say thereafter, began looking in the literature and trying to understand and being exposed to some of the work that had been done decades ago, but linking isolation to mortality was like kind of mind-boggling that nobody had really talked about it or taught me anything about it during my clinical training. Yet the impact of isolation in some instances, or some studies bear out, has a bigger risk than smoking cigarettes or a sedentary lifestyle. But yet we focus on these things in our clinical encounter, yet we don't really talk about, how isolation can be deadly.
Yeah, and that was an interesting moment for me. I think pretty much every time anyone talks about isolation and loneliness now, in terms of older adults, that study around the having a similar effect on health systems as cigarettes do was shocking to me. It was one of those things that it's hard to think in those terms. But from a medical perspective, what does isolation do? Like what are the risks that people face because they are socially isolated?
Yeah, so it's I would say that we know a lot, but there's more work to be done. And so there's decades of epidemiologic work that associated social isolation with so many different poor health outcomes. And then there's also data. I would say that we have to be thankful for people who have compared outcomes in social isolation to outcomes in other important health factors to see that social isolation has this burden that's similar to cigarette smoking or elevated or BMI elevation or even the flu vaccine. There's a great paper by Julianne Holt-Lundstedt that kind of links these things together and puts parallel between social isolation or social relationships and some of these other important outcomes. But getting to your question, the pathways between social isolation or disconnection is, we think about biological pathways, think about behavioral pathways and psychological pathways. And so disentangling how paths lead to morbidity, bad health, and mortality, death, is work that needs to be done. And I think funding institutions are beginning to understand that more and increasingly funding efforts to study this. The reason it's important, and I'm glad that you asked about this, is because in order to find good solutions, we need to understand the pathways that which connects isolation to these poor outcomes so that we can target interventions in the various types. The National Academies of Sciences, Engineering, and Medicine have a great report that came out earlier this year that kind of characterizes all we understand now and where we need to go. And so I encourage listeners to check it out. There's a great resource for us to.
I saw that after you and I spoke at the thing in Maryland not that long ago. It's an amazing report, and it's kind of scary. You know, I mean, it really does spell out what, you know, that this is a pandemic too. And I wanted to talk about that with you too. I mean, obviously we're in new territory right now, at least in my lifetime.
Yeah.
And how has the pandemic affected the concept of social isolation amongst older people?
Yeah, so the coronavirus pandemic and the social distancing, I'll say social distancing with a quote, because I would say we really want to think about physical distancing. And we can talk more about that, but these events and have transformed the way we interact. Before the pandemic, national studies, work that I've done, found that about 1 in 4 older adults were socially isolated, and more than 40% experienced loneliness. And like we talked about, decades of observational studies have demonstrated the long-term negative health outcomes of isolation and loneliness. The COVID-19 crisis has exacerbated those pre-existing challenges with worsening isolation, worsening loneliness, particularly those who live alone or are frail, or even with declines in well-being, which is particularly experienced by older adults, are not necessarily doing well during these times. I think evidence is coming out to suggest that. But not only those people who are not doing well before aren't doing well, but people who previously lived healthy and active lifestyles are now experiencing this amid the pandemic. We've seen community centers close. We've had nursing homes, their visitation policies have been terminated. We know family members, particularly thinking about grandparents, are not seeing their grandchildren. And I think that we initially hoped that the restrictions would be temporary. But now I think people are many months in are beginning to experiencing what people who are isolated and lonely experienced prior to this pandemic. So I think that it's been an interesting year for all of us. And I try to look to like, where are the opportunities in this? And I think that one of the opportunities is that for some people who have the privilege of thinking about this, we've been able to give it more time and attention. And also, I would say it's brought about greater awareness for the problem. So hopefully we can begin charting a future where we can effectively put in place strategies to mitigate isolation and loneliness. So,
yeah. You've mentioned social isolation and loneliness, which is something that I wanted to bring up because I think a lot of people think those concepts are the same thing. Can you talk about the difference between social isolation and loneliness?
yes, I think it will help to define them, and then I'll try to be clear about how we can distinguish them. So when I think about isolation, I think about objectivity, like or the objective lack of or limited social contact with others. And when I think about loneliness, I think more about the perception, or we should be thinking about the perception of social isolation, and that's subjective, like this subjective feeling of being lonely. So we have isolation over here, which is objective, and loneliness over here, which is subjective. And so in distinguishing the two, social isolation, like these low levels of contact with others, whereas loneliness is more of a mismatch between someone's actual relationships and their desired relationships. Isolation, social isolation, some people may choose to be alone. We might say that certain personality types might select for being isolated. Whereas loneliness is unpleasant, it's emotionally distressing. People may not want to be by themselves, and they might actually be amid many people, but they feel that they're not connected to the group that they're in. Isolation is this chosen solitude, whereas people who are lonely may lack a sense of control or choice of where they are or their current state. I would say that's the best way I think that I can distinguish them. And it's critically important to do them because the solutions that we might think about to address them or the pathways between isolation and poor health or loneliness and poor health may not necessarily be the same. And
Yeah.
Yes. Yeah.
I mean, it's interesting. You use the word solitude too. I was reading about William Wordsworth over the weekend, and he talked about the fact that he would pursue solitude to write about loneliness. I thought that was interesting. That solitude can be, again, I guess solitude was kind of the original social isolation because solitude sounds more like a choice than isolation does.
Definitely, and it's that choice is important. We know about the ascetic movements of the past, where people have chosen. Some religious groups choose to go through periods of retreat, and that's a choice, and that's a sense that they're part of something bigger or part of a group, and they can choose to end in that period of being in solitude or being alone. And so, whereas loneliness is essentially that lack of choice or not feeling that even if you wanted to choose, that your needs might be met or emotionally or instrumentally. And so, it's a significant problem that many people are facing. And I guess I think it's important to state that I'm happy to see that in our country, people are beginning to pay more attention to this and note that our colleagues in the UK have been thinking about this a little bit as well. And they, appointed some time ago a Memphis minister on loneliness. So it was great to see, our institution putting forth that this is an important problem. And I think since then, a lot more people have been attentive to this problem and its impact on older adults, but also on other groups. I think that's something that we have to point out, that this is not just a problem that impacts older adults, but can impact people across the life course.
And it is interesting because you mentioned awareness as being one of the things that was a hidden gift to a certain extent of the pandemic, because so many people have gone through this and are experiencing those feelings or the actual idea of isolation. From an awareness perspective, will we in the United States get to a place where we have, I always thought Minister of Loneliness sounds kind of like a 80s new wave band. And I think what we're really after is more, we want a minister of social connection. It's kind of like we want to kind of solve the problem, not play to it. But like with the Biden administration coming forth with, they're already putting together a COVID-19 task force. Is there a possibility that could be a part of this? I wonder, could we get a social connection czar or something like that?
Yeah, well, I think it's encouraging about some of the leadership of this COVID team. One of the individuals being Vivek Murthy, who we know has an interest in isolation and loneliness, so much so that he wrote the book Together. So I think that people in leadership are going to be aware of this problem by the mere fact that it's an area of interest and focus for our previous Surgeon General. And so I'm hoping that there'll be more work that's done. going forward. We also have this coalition to end social isolation and loneliness that is formed, and bringing partners together across different age groups, across different interest groups to tackle this problem. The other thing that I'm glad that you pointed out is, how can we be asset focused versus deficit focused? So I've mentioned isolation and loneliness a lot here. And I really am trying to evolve my terminology and evolve how I talk about things, and focusing on, social connection. And so, that's work that we have to do, because when we define things or characterize things in different ways, I think it can help people understand that we all can be moving in this direction. Whereas if we focus on isolation and loneliness so much, it might have some level of stigmatization of certain groups, and we can't all identify with the challenges that might exist. So I appreciate your pointing out that.
And you did some time at the Harvard Public Health School. Is there a way that as communities we can focus on how we design around the idea, both programmatically and physically? I'm struck by the picture that you're sitting inside.
Yeah.
Tell us where that is, and how that actually looks like it might be a good solution for social isolation, what you're sitting inside right now.
Yeah. So I'm in Havana, Cuba, virtually. I'm just joking. So this is in Havana, Cuba, the Paseo de Marti, which is a long promenade in Old Havana, and like you suggested, like social infrastructure is critically important to how we connect and how we maintain our health. I think that we have to invest in infrastructure that enable people to be healthy if we want people to be healthy. We know that we spend so much on health care, but oftentimes our social spending is so much lower, and we know that it's so much that goes on outside of hospitals, outside of the doctor's offices, that lead us to either good health outcomes or poor health outcomes. And so I think this example of where I'm sitting is an example of how a place can facilitate people to come together, for people to be warm and comfortable and happy in environments which can buffer stress. And our environments can be places where people, want to go to do physical activity, to want to go to enjoy time with others. So, I think the work of Eric Kleinenberg is particularly interesting. He wrote a book, Heat Wave, that spotlighted the impact and burden of being isolated on the health of individuals in Chicago during, I believe, the '95 heat wave, where more than 700 people died. And many of those people who died were isolated, alone, and older. And so one of his recent books, I think within the last year or two, is entitled Palaces for the People, and it really focuses on the role and value of social infrastructure in terms of our health and well-being. So I'm hoping that in the times to come that we'll be investing in these type of infrastructures. Will come in different forms. They come in, parks. They come in the form of supporting organizations that do good things in the communities. They come in a variety of ways. So.
It's great. I know you're in the process of studying social isolation. I had a conversation with one of your researchers earlier this week, and she did a fantastic job asking questions about what you're trying to get to the root of. I wonder, how difficult is it to get people to really talk about isolation and loneliness, and what are the ways? I guess the question is, how do you ask the question in order to get people to tell you where they are with things that can be considered personal and private and potentially scary for some people to talk about?
Yeah. And so I would say that I'm evolving in how I'm approaching it. The work that we're doing now is involving engaging stakeholders around the country who are particularly focused on connections and health of individuals who live in subsidized housing settings. But as we are, I have NIH funding to National Institutes of Health funding to do more of this work in subsidized housing that particularly engages individuals who live in these settings. And so the goal there is to engage people who are both isolated and integrated. Like we talked about asset focus. We want to talk to people who are experiencing both because they both have important stories in terms of their trajectory to where they are. And one of the ways that we envision talking about it is not necessarily having the people talk about themselves, but using hypothetical scenarios to say, what if this person is, isolated, how might we support them? Or and that potentially can move away from the potential stigmatization that may exist. We also hope to do objective survey measures where we do them with the older adults. So we'll know based on how they answer a series of questions or based on who they say is in their network or what are some of the things that they engage in on a regular basis, whether they're isolated or not. And so I think that will help us understand more in bringing together that quantitative information as well as the qualitative elements will begin to help us devise solutions for the future. So, or adapt solutions that are existing. Engage is a prime example that I think is a great opportunity for us to think about how do we measure the outcomes of it and how do we effectively disseminate solutions like this more broadly so that they can benefit more people throughout our country.
And when you and I were talking yesterday about this, we were talking about the idea of looking at the effects of social isolation and loneliness. And then it's almost like when, we were talking earlier about asset-based thinking around looking at something that, the asset side versus the deficit side. And I guess the language is still coming to us to a certain extent on what you're almost like trying to create the opposite effect or feeling of isolation and loneliness. And I guess we have some ideas what those might be, but that seems like kind of work still to be done, right?
Yeah. And I if I'm understanding you correctly, I may not be, but if I'm understanding you correctly, I think I would say that we have to evolve our language and evolve what we think might be solutions. And I think that we have to be informed by what people's experiences are and how they describe their experience, and not try to make up what we think is best for people, but to understand what people's goals and purposes are, and try to support them in that, and not say, oh, you screened X, you screened in for X, so you need this. I think it's an engaged process where we understand where people are, understand what people's goals and purpose might be, and try to support them in achieving that. And I think that's where we'll see benefit, where people can get that fulfillment that they desire, and helping environments and people who are, in control of some environments, helping them to realize all the value and capital that exists within the people who are in those environments, and how the environments can be so much better when people connect meaningfully.
Yeah, during the interview with your researcher, one of the things she talked about was she asked me to tell a story about someone who was experiencing social isolation and loneliness, and then someone who was not, and what's the difference between the two. And I guess that's kind of that's one of the approaches I would think would be, yeah, your definition of loneliness is the idea that there's a disconnect between what you want in terms of friendships and connections and what you actually have. So people could look like they're surrounded with people but still feel lonely. So what's missing is that sense of belongingness or connection or community, or, like things that I think are hard to probably define and quantify.
Definitely. So I would say that there's, by the nature of how life occurs for some people, some people have lived a strained existence and have, in some instances, lost or not developed the ability to regularly interact and engage with people in the way that they may desire. So there may be opportunities for people to, for us to figure out how to support people in that journey. So I think that going back to the infrastructures which people grow and age in, are critically important. Imagine if a person is, much of their life experience has been in a crime-ridden area where they've had to turn around and make sure that they're not being a victim of violence, or they've been in a relationship where or relationships where they've constantly been abused and taken advantage of, trusting people readily who are hoping and to support them or being really good natured in attempts may not be received in the way that you might imagine because of that life experience. So I think that the issue is complex, and we have to really seek to meet people where they are.
Yeah, it's one of the things that we talk about, the places that we serve, people who live in affordable housing. Often the triggering event that happens when someone moves into a place like that is often loss. So there's a built-in sense of you're entering a place where you're expected to connect with people at a time when it's probably the least easy part of your life to do that.
Yeah. And sometimes access to certain housing communities, there may be waiting lists, and you may come off the waiting list in a part of town that you know nothing about, and you may have had community, you may have had people you were connected with who were proximal, or places that you were familiar with and that you were comfortable going. But going in, when you move into a new environment, it's kind of like starting high school over. And it's reestablishing connections and networks, getting familiar with, the existing structures and circumstances in a new place. And I think that for older adults, that transition can be challenging. And I think that we can definitely figure out ways to support people in that transition. I imagine in more higher income settings, think continued care retirement communities, there are many resources and wellness directors, et cetera, that support people during those transitions. And there's a plethora of activity and support that people are, they're paying for in some sense to benefit from. And so I think we also have to be thoughtful about older adults who aren't as economically privileged and how they make that transition as well, because it impacts their health, and impacts public resources.
Yeah, it's interesting that you mentioned too that it's impacted by things like race and culture and class and gender, and all of that plays into the ease of access. Language, we work in Los Angeles. There's 70 something languages spoken in our communities, so the idea of just simply being able to communicate with others can be very difficult.
Definitely, and that is that's not even talking about the potential sensory disability that people may have. People may have hearing impairment or vision impairment that further challenges their ability to connect with others. So those things we definitely have to understand and support because they are directly related to how people connect with others or their experience of being lonely.
We're headed into some challenging territory this week and the rest of the year, obviously, around the holidays and the challenges we still have with the pandemic and people's health safety. Any ideas on how we might handle that better? I mean, obviously, we're Americans. It's been a difficult process for us to do what we're supposed to do for some reason, and also this idea that it's going to last, obviously, a while longer.
Yeah. Well, I'm hoping that as our holiday seasons approach, that outpouring of support that I would say has occurred in communities throughout the country continues and is reinvigorated during these times. The holiday season is oftentimes a time of year where many people do the experience alone. And thinking back to the patient that I was talking about earlier, that it was during that time of year where she described to me, I have 4 children, and none of them came by for the holidays. And you can think about that in a few different ways. You have 4 children. How did the relationships get so strained where nobody is checking in? How does that happen? How and where we, coming into this, how do we support them? But I think that the awareness that we've talked about and the opportunities during the holidays are endless in terms of thinking about how we can support people. If it be a group of your listeners deciding, hey, we want to write letters, we want to bring gifts, or we want to bring different things to people in certain communities that we may know are at risk. If we want to donate money to take Engage nationwide, right? There's opportunities, and we know there's people with resources that can support. And when I say resources, financial, time, there's all types of resources that we can think about how help people feel more part of a community, connected with one another. So.
Yeah, it seems like part of that is creating community where you are with what you have. I mean, I know in your talk you talked about meeting people where they are, and I think that has to be an important piece of this, because family is complicated and people have their own issues they're dealing with and all that type of stuff. So part of it goes back to this, the plaza you're sitting in Cuba. How do we create community where people are and where start there?
Yeah. It's I think it will vary depending upon where they are, and I would say that we have to just acknowledge, like the people say, it is what it is. So we have to just acknowledge that that people are who they are a product of their experiences and everything that is going on in their life, and we can use certain media, I think, or mediums to facilitate connection. And I think the arts is one of them. I don't know too many places that you could go that, at least in the interactions I've had, where you play some music or you do something that's creative, then that if it's something that someone identifies with, that it doesn't bring about some joy in that person's existence. So I think that there are ways to figure out how to bring people together, how to bring about wellness and joy that I think we all want for one another. So I think that we talk about morbidity and mortality associated with social isolation and loneliness, but important outcomes are also like happiness and joy. Like
Yeah.
how do those relate to some of these things? I think are also interesting questions to pursue in terms of are people who are connected in a more meaningful way, do they have a better quality of life? And so I think that that's something that I think we need to be reflective of as well when we think about research and we think about how do we evaluate certain solutions that seek to bring people together and address isolation and loneliness.
Yeah, one of the things we see in you mentioned the UK, the Minister of Loneliness, and I know Melbourne, Australia has a big program around social prescribing, where they're prescribing visits to museums and participation in arts programs and things like that. They like using the arts and lifelong learning as almost a social intervention to deal with isolation and loneliness.
Yeah, I think those are examples of great areas that we can utilize to support people, and I do encourage my fellow physician colleagues, physician or all health practitioners, to think about that and being understanding of where their patients are and trying to seek to support them in that way. And having that in the toolbox as well, to be encouraging those elements of our lives as well, because someone with hypertension and diabetes who is unhappy is totally different than someone who's has hypertension and happy. So I think that that mental health aspect of things directly intersects this, and I think we all know about the relationship and the particular burden that exists when people don't have a sense of purpose, or they don't have a sense of joy in their life. So
you've mentioned intergenerational connectivity in your own life story a couple of times, your relationship with your grandparents and then the impact that the woman that you walked on the ward had with you. What do you think about the idea of trying to find better ways to connect across generations to have some impact on this?
Yeah, I think that's the way. We're gonna have to see it. We know that the numbers of people who are aging is it's going up, whereas there's a lot of the numbers of people, number of children being born, that rate is kind of plateaued, or in some it might be declining. So we're going to see more older people. We're going to be getting older ourselves. You and me, Tim, both we're getting younger. And so I think that it's something to be reflective of. I feel like I've lost the question. Yeah.
Just the idea of connection across the generation.
Intergeneration.
Yeah.
So that I think about my, like, I have so many of these experiences with older people. Even so much people used to joke with me and still joke with me. They say, "You're an old man, Thomas." But I think it's because I've had such positive experiences with older people. So when I was a medical student, I rented a room for some of my time from an older woman, and I would say that I was in New Jersey. I had the the person I was renting a room from was an older white woman, and I think she was in her 70s, 75 during that time. And I would tell you that we learned so much from each other during those times.
That's cool.
And like in some of my presentations, I share pictures of her because she would go teach English in foreign countries during the summer, and but she would rent rooms to medical students, like I think for a period of like 20, 25 years. So I'm sure many people had great interactions with.
That seems like such a great no-brainer of an idea, like people who are isolated or feeling lonely, who have space, and college students who need inexpensive places to live. It just seems like that's kind of a solution waiting to happen right there. I know there are other countries that build dorms that are intergenerational. It just seems like a no-brainer to me. Yeah.
And so I would say in our country, there's opportunities. I think some of that has occurred or is occurring, and so there's these bright spots. But I think we have to learn about them and try to do a better job in disseminating them more broadly. I think that the idea, just as you described, how do you make a congregate setting more age inclusive, and so. Is there ways to share resources? I advised a startup company that sought to do that, where essentially they were supporting people to how to utilizing their space in a way to basically rent a room or rent part of the house and sharing some of the costs. And I think we're going to have to see more of that as the population ages, as savings. We had the Great Recession. Now we're experiencing the pandemic, which is forced retirement for some people, and it had sent our economic system, and it's in such flux. And so I think thinking about how we can come together on things like housing, I think will be important, or be an important approach to supporting and nurturing intergenerational relationships.
Yeah, it seems like there's an opportunity with the new administration. The idea that there is this COVID task force seems like it opens up a wider opportunity to look at health from the way you did in the program at Robert Wood Johnson. The idea that health should be looked at in a broader way. And then also the idea of potentially getting geriatric physicians and gerontologists in that circle as well to look at lifespan health, because that doesn't seem like something we've really done very much of either.
Yeah, I'm hoping they're listening, Tim.
Yeah, I hope so too. Well, Johns Hopkins, you can practically throw a rock and hit the White House. You guys got to get over there.
I'm hoping they're listening. I would say that one of the new unique things about geriatric medicine is that I think that we really are exposed and are taught to understand people, the whole individual. From the nuanced clinical aspects of their life to their social context and the people who they engage with, and the trajectory of how. And so I always say that a good geriatric training is an approach that impacts the health of or is concerned about the health of older people, but is also concerned about how people age. I tell people that regarding just thinking about the healthcare aspect of geriatric medicine, we care for people in all settings. Like I told you, I do house calls, but there's geriatric providers who are, doing consultative practice in the critical care setting. So I'm saying from home to ICU and everywhere in between. And so I think that the leadership of our country, people who are making decisions, they gain so much when with the expertise that I think geriatric principles offer. So I'm hoping that the COVID-19 task force gets more interest and broader focus on things, not just focus on getting a vaccine out and getting us to wear masks and physically distance, but also on, the implications of how social factors have led to certain groups being burdened by this pandemic at greater levels than other groups. So, I hope that work doesn't just stop in terms of thinking about, these social determinants and how they are impacting us during the coronavirus pandemic, but also how we can put systems in place to support us going forward.
That seems like another kind of hidden gift of COVID is there does seem to be some awareness and realization of the gaps that our healthcare system has in terms of disparity, the haves and have-nots around how that has an effect on people's health and community. It's huge.
Definitely. We talk about, equity, and, equity is essentially giving people what they need, right? And so, that's going back to where we say meeting people where they are. Different people may have different needs. And so I think if we're trying to figure out and support that, I think that's the secret sauce. That's the secret sauce of, giving people what they need and meeting people where they are. If we can do better, I think we'll be much better off as a nation.
Yeah, it seems like it's interesting that isolation and smoking have been compared with each other because, we talked about awareness and like a public awareness campaign. The smoke, the Surgeon General smoking campaign might have been the most successful healthcare awareness campaign ever. It's just that, the Surgeon General says this can kill you. So I wonder if that's not somewhere we need to go with this kind of stuff. Is that because I don't think people know how dangerous this is.
Yeah, and I think that that can have that gets greater awareness, and so I think that after we come through to having greater awareness. It also creates a space where people can begin thinking about where are the solutions and how we can best address it. So I think that that's a critical first step in terms of broadening the awareness. And some of it is occurring now with our pandemic and, more exposure of this topic in public spaces. And so I think that now I think that needs to be aligned with, a broader campaign to do that and sustain this and not, this not just being, a year from now or 2 years from now that we go back to not seeing this as an important topic, but that we sustain our focus on it. Because, the people who were experiencing isolation and loneliness before is probably worse now. And people who weren't experiencing are probably, the way they live and the lifestyles, our lifestyles have changed. And even people in younger people are, resorting, maybe they think it's okay to proceed without connecting with other people. And so I think that we have to continue to be focused on this important topic because it, has a big impact on our health and well-being.
Yeah. Dr. Thomas Cudjoe, thank you so much for being on the show. I always enjoy chatting with you. You're a very cool, smart guy.
Thank you. I hope my kids think that.
There you go. So happy Thanksgiving to you, to everybody out there. Our next show will be in January. We have George Saunders, the Man Booker Prize award-winning author, coming on the show the first quarter. I'm not sure whether it's going to be January or February yet, but he's got a new book coming out about the short stories of Chekhov and how we can look at life through Chekhov. And if you haven't seen George Saunders talk about anything, I highly recommend tuning into this one. He's a cool guy. Thomas, thank you so much. It was great seeing you. Enjoy Thanksgiving with your family, and thank you so much for the work you're doing. It's really important, man.
Yeah. Thank you so much, Tim. I appreciate the opportunity.
All right. I'll talk to you soon.
Take care now.
Thanks, everybody.
Bye.